Welcome to the Radiate Wellness Podcast. I'm your host, Christy Clemens Hoffmann. Each week we will discuss tools, tips, and ways to radiate your best life ever, interviewing practitioners, authors, and luminaries to help you on your path. Wellness, joy, peace, abundance. What do you want to radiate? Hi, and welcome to the Radiate Wellness Podcast. I'm here with Jeanne Mitchell, who is a massage therapist. We're going to radiate motherhood. And you ask, why motherhood with massage? Isn't massage supposed to be relaxing and good for your muscles and et cetera, et cetera? But there's quite a lot more to this. And Jeanne has been practicing prenatal, postnatal, neonatal massage and teaching others as well. So hi Jeanne, welcome.
Hi Christy, thank you.
I feel like I'm talking so loud, but I just got off a plane last night and my ears are completely blocked. So if I'm really shouting, just like give me a sign or something like that.
No problem.
And I'll try to take it back down.
Okay.
And Jeanne is visiting from Longmont, Colorado, right? No.
Louisville.
Sorry, I knew I was going to screw that up. Louisville, Colorado, which is absolutely gorgeous, suburb of Boulder. Love Boulder. Love Boulder. And you practice in Boulder.
I do.
Nice.
I do.
No, so what is the name of your practice?
Well, I work for Faith Davis Massage and Yoga. My friend Faith and I work together, but my office is located within a practice called Joy Collective, which is so the Joy Collective is about 10 practitioners, I believe, a few more, a few less, combining psychotherapy, nutrition, lactation consultants, massage therapists, doulas, and a number of other things, chiropractic, that all support mothers and babies and healthy families.
Oh, yeah. Well, with chiropractic, babies, even we talked a little bit earlier about birth trauma. Babies often come out and we don't even think about it, but their little spines need to be adjusted,
Yeah, you actually see that very regularly. A lot of babies will kind of get in a position in the womb and not move a whole lot.
Sure.
That's what happened to my son. He was kind of like curled up and didn't want to unfurl himself. And then also you see babies who kind of come through the birth canal in an unusual manner that can affect them. And then there's also a thing that happens to babies that's so interesting called torticollis, where their heads will only look in one direction.
Really?
They kind of tend to just prefer that direction. So that becomes kind of an issue when people are nursing. They'll try to nurse on the other side, and the baby's like, oh no, my head is going this way. And so that can be adjusted by chiropractic, often craniosacral, just a very gentle adjustment for the baby. Mm-hmm. So, it's nothing that's like life-threatening, but it's certainly kind of puzzling. Right.
You just kind of go, it's amazing, all the things that can happen, in birth and in gestation and all like this. And so you work with the mother, like during pregnancy, postpartum. So how long have you been doing that?
Well, I graduated from massage therapy school in 2004. Okay. So it's been about 15 years. And then,
it's been a minute.
Yeah. And I had kind of a lengthy college career in massage therapy because I did a night program. So I was working and going to school. And so I had about 2 years of training prior to even graduating. So it feels like it's been a while.
Yeah. And did you always want to do prenatal?
As far as massage, yes. I did. Nice. And I did go to massage school with an open mind and an open heart and wondering what else might come my way or what I might be interested in, but I also chose the school that I went to because they had a really strong prenatal program.
Well, and you've taught it too.
Mm-hmm.
Yeah. So you must know a few things about pregnancy and massage.
I know a couple things. Yeah.
And so prenatal massage, why would a woman want to seek out prenatal massage?
Mm-hmm. Well, one major thing is that it's very structurally challenging for your body to be pregnant, right? All these things start changing. Just your basic posture changes. Also, parts of your body expand to make room for the baby, and not just your uterus, right? But also your ribs flare out.
Really?
Yeah.
I didn't know that.
I find that is one of the more fascinating things about being pregnant, and it's something that when you teach massage, you there's a massage technique that you can use to kind of put your fingers through, like, around and through the women's ribs. But when you're practicing that on somebody who's not pregnant, it doesn't make sense, right? It doesn't feel like that would be anything that would feel good at all, right? But you have a pregnant woman on the table and her ribs are flaring and expanding, and suddenly there's like these grooves that you can slip your fingers into to help release some of that tension. So that's pretty exciting, and that's actually one of my favorite funky things that your body does when they're pregnant. And the other thing, of course, is the weight of the baby makes your pelvis kind of tip forwards.
Sure.
And so that makes your low back hurt. It can make your hips hurt. It can compress things. So, like, you might have a sciatica kind of pain. That happens during pregnancy. So from a structural standpoint, that's a big deal.
Oh, that's huge.
Right, and massage can help allay some of those pains, aches and pains. Another thing that happens to pregnant women is often they start to have trouble sleeping.
Oh, yeah.
So you don't really see people sleeping on their backs or their stomachs anymore as they're pregnant. And so for a lot of people, that's a big change, right? And you're on your side and your hips are already hurting from the pregnancy, and then you're on your side, which you're not used to, and so, and also you might have a little heartburn or some other things going on, and so sleep becomes more restless. You're turning, you're pillowing yourself up, and then you turn over and you have to re-pillow yourself up, and often you're snoring and your husband or your partner like pokes you and says, "You're stop snoring," and you're like, "I just fell asleep."
I just fell asleep. Yeah.
So massage can also help with sleep.
That's great.
It regulates some hormones that help with sleep as well as alleviating that pain.
Regulating hormones, really?
It does.
With massage?
Yes. Yeah.
Really?
Yeah. Well, the most important thing is, for anyone, massage puts you into your parasympathetic nervous system.
Oh, sure.
Which is your rest and relax area of your body. And it also helps regulate your cortisol, which is important for men, women, menopausal women, pregnant women.
It's the stress hormone.
It's the stress hormone, and it is prevalent in pregnancies and also in most people's everyday lives. So massage helps kind of balance that out and helps to cause better sleep.
Okay, well, this is all making sense because I love to get massage myself. And I'm like, okay, there's actual science behind that. That's nice.
Yeah. Sometimes it's hard to find studies about massage and anything because it's still sometimes called a medical procedure, but a lot of times called kind of like a luxury procedure.
Spa.
And it's hard to get medical, real actual controlled studies done on massage.
Absolutely.
There have been a number out there, and we're learning more and more every day, but there is some science behind it, and we're hoping to prove more as we move along. That's
my sweet spot. I love it when there's science behind whatever it is we do. This energetic stuff that I do, I love it when there's science behind that. So that's really great. And I know you've studied all of that because you had to teach it and whatnot. So prenatal, totally get it. The body's changing, uncomfortable. I haven't been through that myself. I adopted, so but I hear all the kinds of things. Yeah. Everybody, you get together with a group of women, and it doesn't take very long before they start swapping pregnancy stories and birth stories and all like that.
Yeah, and that's part of what I love about my practice too, is that it allows a space for people to be able to share, both their anxiety about the pregnancy and also their joy of the pregnancy, to share their birth stories after they happen. And it's something that was actually one of the reasons that I became interested in prenatal anything, really, was because I was kind of entering that stage of my life and realized, I don't know a whole lot about this, and there's not as much information out there as I would like. And a lot of the information is conflicting,
Yeah.
So I really I wouldn't say that I'm an expert in the way that maybe an OBGYN would be an expert, but I like to read a lot about it and have a lot of options to talk through with my clients when they're having concerns about things.
Right. Mm-hmm. Oh, yeah. It helps just to know the structure, the anatomy, the changes that are going on. And, you know, but your focus is not like an OBGYN.
No, it's not at all.
It's very different. More kind of along the lines of maybe a doula even.
Mm-hmm. Or, you know, just providing a little bit of comfort, and then also maybe a little bit of space and a little bit of education, a little bit of connection with the baby. I think that's an important part. Mm-hmm.
Yeah, and so like postpartum then, what is the role of massage in postpartum?
So postpartum is to kind of start to unwind all of the things that have happened to your body during the pregnancy. Right. So you have everything's kind of compressing back down. You have your internal organs are moving from the places that they had been pushed to during the pregnancy to back into their normal place. You, again, are having sleep disturbances.
Oh,
right?
Yeah.
I mean, most women, when you're feeding your baby, whether you're breastfeeding or bottle feeding, those babies eat every 90 minutes, every 2 hours.
Yeah.
And that's a lot of sleep disruption, right?
Yeah, when you've already had a lot of sleep disruption.
Mm-hmm. Yeah.
Your body's needing to recover and heal.
Right. Yeah. And some women have a little bit of a traumatic birth, perhaps, or they might have a cesarean birth that's hard on their body.
Yeah.
Things might not have gone the way that they imagined, and so there's that emotional recovering as well. If people are trying to breastfeed, sometimes that can be challenging.
Sure.
And so to have a little support around that.
You know, you just kind of assume that all these things are going to go the way that you think they're going to go.
Yeah.
And that's not always the case, is it?
No. And I remember from my pregnancy, my husband, said, you know what, honey? There's not 50-plus lactation consultants in Boulder because it's easy,
I love that.
Yeah, it's a good approach. I do encourage people always to, reach out and find help when they need it, because there often are solutions to get you to the place that you want to be as a mother. But sometimes you need to know where to look. And I love that our Joy Collective has a lot of resources like that.
That is wonderful.
Yeah. It's a really good place. And we also happen to be in the same building as the Birth Center of Boulder.
Perfect.
Which is a midwife practice, and they have 3 lovely delivery rooms that are just beautiful and set up for families to be able to spend time together during the birthing process.
Oh, sure.
Yeah.
Oh, that is awesome.
Yeah, they also have a classroom, which is great because we can use that for mom and baby yoga. You can use it for birth classes. There's a lot of resources right in that one little hub.
So you got one-stop shopping, in other words.
Yeah.
So mom and baby yoga.
Yeah.
That's kind of cool.
Yoga. Yeah. Faith teaches that.
Yeah.
And so she incorporates the babies into the class and helps moms kind of also again regroup with their bodies and get in touch with their new reality.
Oh yeah.
Yeah.
So what do you do? Strap on the baby and do some yoga?
Usually the baby stays on the floor, I believe.
Oh.
Yeah, but I have watched Faith, and she does the best illustrations. Like one thing that happens often with the postpartum time is that if women are trying to breastfeed, they often get themselves into all kinds of kinked up and unusual positions because they're trying to feed the baby.
Oh, sure.
And so they're moving their bodies to meet the baby, and so then say they get a good latch with the baby and they're kind of like stuck right here, and their shoulders are up and they're turned sideways.
I don't want to screw this up.
Right. I just keep it going. And so Faith has this great illustration where she, she sits herself back and then she says, then, get yourself arranged and then bring your baby to you. And you can just see all the moms in the room kind of to realize that they can take the time to get themselves into the right position that's going to be comfortable for them and baby, and start to kind of get this stuff back into its normal position.
People don't tell you that.
No. No, nobody tells you that.
We've been doing this for how many years now?
Right,
a
lot.
Babies, and nobody tells you that kind of thing.
Mm-hmm. Right.
Right?
Yeah.
Well, we too used to be in a society where it would be nothing for your mother, your sister, somebody to come and stay with you for a month or two until you get these things figured out. But we don't do that anymore.
No, not really. In fact, a lot of people find having family in town right around the immediate birth can be really stressful.
Well, that's true too.
Yeah. So you have to really pick and choose carefully who you invite into your new baby world.
Oh, absolutely. And like boundaries and all kinds.
We are seeing a really nice encouragement, though, to do some what they call laying in with your baby, which can be anywhere from 10 to 40 days of staying in bed naked with your baby, just really recovering from the birth and having people care for you as best they can.
I just read a novel by a Greek author where they talked about the daughter of the family was her laying in. It was 40 days. And she couldn't go to church. She couldn't light candles. She couldn't do anything. And just had to be in bed and recover. And I thought, oh my gosh, wouldn't it be wonderful to be able to do that?
It would be wonderful. Yeah, I'm not sure everyone has that luxury, but I love the idea that it's starting to come into the vernacular that we might discuss it.
Come back into the vernacular.
Come back into the vernacular, yeah.
Right.
Yeah, and we like to even tell our clients that, your body is running a marathon. Like, you might be on the go with your labor for 36 hours, for 48 hours. And it takes time to recover from that.
Oh, yeah.
So you should not be up and vacuuming 2 days later.
No, and guess what? You only recover, your body only rebuilds when you're resting.
Exactly. So the more that you can rest at the beginning of right after the birth, the better that you will recover over time.
Yeah, well, I remember when my daughter was a newborn, and again, I adopted, and so I didn't have the whole body trauma, but people said, nap when she's napping. And I'm like, oh, that's ridiculous. That's when I wash bottles. That's when I do laundry and those things. But you do need to have rest, too, of course.
Yeah, and I think it starts to change your perspective of what a well-run household looks like, pre-child, post-child. The standards, I think, become slightly different for a while.
They do.
Yeah. Yeah.
They do. And your body has been through this ringer that you need to recover. And so that would help. So, and then about the baby. The baby's also been through a trauma. Birth is traumatic.
It can be.
You get squeezed.
Babies do a lot of work.
Oh, tell me more about that.
Oh, this is one of my favorite things to talk about, actually. So, babies, let's assume that your baby is in the correct position and is going to come out where it should come out. One thing that I find so interesting is that the lump on the back of your head, which you can feel here. So babies, when they come out of the birth canal, are actually facing the floor. Okay. So they're facing backwards.
Okay.
The squishy part of their face is up against your tailbone on the inside. And so their head comes out, and this little place on your skull right here, that actually locks itself underneath the pubic bone and torques the baby's head out of the birth canal.
What? That's crazy.
Yeah. Wow. And then the baby starts to move out. The baby turns itself sideways so that its shoulders can come out of the birth canal.
Wow. Well, this is in a perfect world, in a perfect position, and like that.
Yes,
right.
If everything's going according to the perfect plan, that would be exactly what happened.
Isn't that amazing?
Yeah, it's totally amazing.
And our bodies just know how to do that. That is so
and the baby knows how to do that. I think that's what's really interesting.
That's what's cool.
Yeah.
Oh, that's wild. But other than that, and then, of course, we've got all of these fissures and things in the skull, so our skull can kind of compress a little bit.
The baby's skull is actually a little bit collapsed. That's what the sutures are. And that's why the baby has a kind of an open, empty spot in their skull.
On the fontanelle.
On the fontanelle, when they're little. It has to do with that kind of growth. Yeah.
Oh, totally. They look like aliens when they come out.
They do. They do look a little bit like that.
Pointy, misshapen head and all like that. But it's, my God, I mean, if we went through that type of trauma as an adult, that would be, you would need months and months to, that'd be really significant.
Yeah.
So massage can help the babies recover too. So tell me a little bit about that.
Yeah, so infant massage is fantastic. It does all kinds of good things. It helps develop the neural pathways with the baby, the kind of like right-left kind of organization of the brain. It also is incredibly helpful for gassy babies, which I'm coming to understand that there's just babies. There's not any gassy babies. They're just babies. And they often have trouble digesting at some point or another during their infanthood.
They have to develop their enzymes. They've got to learn how to do this.
Yep. And so it improves their muscle tone. And then, most importantly, it improves the connection that you have with your baby.
Yeah.
So it's a great thing for moms and babies. You start to learn cues from each other. Babies, for example, will let you know if they don't want to be massaged. They will turn their heads or they will cry. There's all kinds of little signs that you start to notice as you're paying more attention. But it's also a great way for partners who were not the ones giving birth, or perhaps like adoptive parents, to connect with the baby.
Yeah, we did that with my daughter, and it was amazing. It was great for bonding and that connection. I really got to know her little body, and yeah, it's wonderful. And I took classes in it, which you've taught.
Yeah,
teach parents how to rub on their little babies.
Yes.
Yeah, I was always so afraid that I would break her or something, but no, she was. They were remarkably resilient.
Yeah, well, and I think that's the biggest fear that parents have, is that they're going to do it too hard or in the wrong way.
Yeah.
But yeah, babies enjoy pressure just like adults enjoy pressure and compression. When someone's tickling you, it's not a very good massage.
Yeah, you're absolutely right. And that's why I think the weighted blankets are so comforting, and for the dogs, the weighted shirts are so comforting because we enjoy that pressure. I know for my daughter, she loved it. I mean, it helped her skin too. She had eczema and had some skin issues when she was a baby. So with the lotion and et cetera. But no, that's a wonderful thing to do. It sounds like your whole practice, not just what you're doing, which is awesome, post, after, or pre, post, and neonate, but the whole group, the whole collective, sounds like it's really together to foster this motherhood, to foster this connection.
Yeah, it's really nice to have resources. The resources that we have, it's really nice that they're there. Being a mother can be really challenging, I appreciate that there's lots of different people around me that I trust, that I can refer my clients out to. There's a pelvic floor specialist, if people are still having like anatomical issues. There's an acupuncturist, which is good for all kinds of things. We also have a male therapist who specializes in talking to dads and talking about what it's like to be a man and a parent. But we all also really enjoy working with the rest of the community as well. We have all kinds of members of families and mothers and we're all connected in that way.
Oh, so it's not just the prenatal, postnatal.
No, it's just kind of family oriented. So yeah. I believe their tagline is the pregnancy parenting place.
Hi, this is Christy. I just want to say that we here at Radiate Wellness hope you are enjoying this podcast. It's free to you, and we hope that you find it informative and inspirational. Heck, even fun. We have just 3 small asks of you to help us radiate growth. First, please hit the subscribe button on whatever platform you're listening on. That way, you'll receive a notification every time that we have a new podcast episode out. Next, please give us a thumbs up, a like, or a 5-star review. If you're feeling inspired, a positive review wouldn't hurt. These 2 small things will help others find us when they're searching for great podcasts. Finally, please tell your friends about the Radiate Wellness podcast. Better yet, show them how to find us and how to subscribe. If everyone did that, we would double our audience. Thanks a lot. We really appreciate it.
Love it. Pregnancy parenting place.
Yeah.
Love it. Yeah, and what you do fits in great there. I love that it's all comprehensive. A bit earlier we were talking about birth trauma and how it's not just the babies, but that there are actually counselors, psychiatrists, therapists who are there in this practice to help with. Can you tell a bit about the birth trauma, like for the mother?
Yeah. Well, so any number of things can happen, and we're always sad to hear reports back when something hasn't gone quite the way that people expected. But, things can happen all the way from the birth just wasn't quite the way that you expected it to be, or perhaps something, if you were having a hospital birth, didn't, something with the staff didn't quite jive with what you were wanting to see happen. Sometimes there's some sort of emergency with the baby that might come up. Sometimes there's an emergency with the mom.
Yeah.
So all these things can happen, and often they impact you emotionally and physically, and it adds that much more to your recovery. There's also, I haven't really had to deal with this with my clients too much, but their birthing can bring up past sexual trauma for women.
Yeah.
And so often women find that they're having to deal with that. It's kind of like a reemergence of those feelings and revisiting that time in their lives.
Sure.
Also, sometimes bringing children into the world can make people, survivors of abuse, start to have worries about their children. Right, and so it can be physical, it can be emotional, and I feel really happy to be working in a collaborative space where women can get the help that they need. And sometimes it's their partners, sometimes it's men, but I do think that when women feel supported in the decisions that they're making, even if the birth didn't quite go the way that they had imagined, they usually come out of it feeling pretty okay. And it's when something really drastically emergent, an emergent kind of event happens, or when sometimes women feel a little bit pushed or bullied into doing something that they didn't have in mind, or for some reason the doctor patient communication isn't going very well.
Sometimes I hear about their doctor happens to be on vacation when they're going to labor.
Right, and so they might have a different doctor. And usually, my experience is that usually the practices try to be really clear about, what's going to happen at your birth and what might potentially happen with the staff. But I will also say that we're really lucky in Boulder that we have a number of different choices for women as far as what kind of birth they want to have. And I feel like all the people in our community, whether at a hospital or home, midwives, whatever's going on, that people are really supportive of women trying to have the kind of birth that they want. And so I feel really lucky that most of the people who come back to me after their birth haven't been pushed into doing something that they didn't want, or feel like they were pushed into doing something birth-wise that they weren't comfortable with.
Right.
So I do feel really happy that in our community we have a pretty supportive birth process for a lot of people. But it does occasionally happen. And I think sometimes I have clients who come from other places who have had a bad experience. Some places in the country are not as supportive as women and their choices during their birth. So, you have some of that going on as well.
I have a client who the first birth was in a hospital, and she was so traumatized, didn't feel supported, didn't feel listened to, didn't feel like she had a say in what was going on. She was like, never again. Decided the second time to give birth at home in the bathtub. Only problem was they lived like 2 hours from anywhere, and things went horribly south. And she had to, she almost died. By the time they got the ambulance there, she was so far gone they didn't want to move her until they got her stabilized. So it was traumatic for her and the baby. Right. So then after that, she's like, okay, the third time we're gonna go back to the hospital. And just being a little bit more specific and knowing what we know now, just, say this is how we want it to go. So, everybody's birth experience, I think, could be very, very different.
Yeah, even the same woman can have a number of different birth experiences.
Right.
And that's where it's really helpful to have a doula with you. So a doula is a birth assistant. And what they do, they're not a doctor, but they can be with you during the entire process and help inform your choices. They know what your birth plan is, that they're to support you and your family, who's ever there with you. And so when a doctor or a nurse comes in and says, this is happening, I feel like we want to do X as a medical procedure, the doula can say, okay, well, let's talk about what happens if we don't do that. What happens if we wait a half an hour before we do that? What happens if what are the ramifications of doing that right this second? And so you can kind of talk through what your options are.
Yeah, this doula's an advocate.
Yeah, absolutely an advocate.
When you are so,
involved.
You're so involved. You're a little too close to it, right?
Right, yeah. There have been studies done about doulas, and what's very interesting is that there can be a woman in the room knitting, not even interacting with the mom, and the birth outcomes are better. Right? There's less interventions.
Yeah.
There's less traumatic birth. Right? So
that's amazing. So the woman doesn't even have to do anything. Just be present.
Just be present. Right? So then add on...
I love that.
Oh, and they know a lot about birth and have been to a number of them.
Right.
And can help you make some decisions.
Well, especially if this is your first birth.
Right. And that's kind of back to what I was talking about at the beginning, that a lot of women don't, even though you go to birth classes, even though you read all these books, we don't know. We don't know what it's going to be. We don't know how our experience is going to be. Oftentimes our mothers, our aunts, our grannies aren't talking to us about their birth experiences.
Right.
And also they might be completely different, because they were 30 years ago or 40 years ago.
This is true.
Yeah. So I always gently encourage my clients to think about having a doula as well, especially if it's their first birth, and then sometimes anytime, right? I was lucky and had a doula. We chose to have a doula for both my births, and so that was great.
Yeah. So how much interaction do you have with the doula beforehand?
I personally don't have any.
Really?
Yeah. So I'm kind of off on my own. However, Faith is a postpartum doula, and another woman in our group, Michelle Kolakowski, she runs a group called Sanctuary Doulas, Sanctuary Healing Arts, that has a number of doulas on staff, postpartum and birth doulas, as well as massage therapists. So she kind of has her own thing going on. And we also have a number of doula groups in the Boulder area for people to choose from. So there's a lot of support around that.
Good. So people don't really necessarily have a lot of interaction with their doula before the birth.
Oh, I'm sorry. The client is somebody, if you hired a doula, I misunderstood your question.
Sorry.
If you hired a doula as a pregnant woman, you would probably have 2 to 3 meetings with your doula. I mean, you'd first meet with them to just see if you like them or not, right? To see if it's a good fit.
Yeah.
And then you'd have a meeting where you talk about your birth plan. So lots of people, even if it's not a formal plan that you've written out, they have in their minds, oh, I really want to get an epidural. I really don't want to get an epidural.
Right.
I would be open to being induced. I would really like to not be induced. I'm totally opposed to a cesarean birth, and I need you to help me figure out how I can make sure that doesn't happen. I'm open to any kind of birth that gets my baby here healthy. So there's a lot of different approaches, and so you talk with your doula about what you're open to.
Sure.
Also keeping in mind, I think always with a gentle nudge that what happens, and the ultimate goal, I mean, that's the thing, our ultimate goal in this country is healthy mom, healthy baby. So often all those things trump your own personal wishes.
Sure.
Right? Sure. Which kind of has pros and cons. in some ways, right?
I know. Yeah.
So you'd meet with your doula and talk about that. You might meet with them again and do some birth prep, or
Right.
you would probably do a birthing class of some kind.
Sure.
Sometimes people do that just in the hospital. There are also private classes that are often offered in the community. And then your doula would be at your birth. And each individual doula would figure out with their client how much time they're available for. Like, some people go kind of for the whole birth and just stay up with the woman. Some people have birthing or doula partners that kind of like step in for them after 12 or 18 hours
kids or something like that. Right.
Yeah, so it kind of depends. And then often there's a follow-up meeting, or I wound up, for my second birth, I hemorrhaged after the birth. So I actually wound up calling my doula and having her, I interrupted her sleep, I'm pretty sure, but I had her come back to the hospital because suddenly everything was changing and getting really hectic and crazy, and I needed more support that way.
Sure.
So thankfully she came back and, kind of kept me company through that process. But yeah.
That kind of puts me in mind of like this is a really weird parallel to make, but hospice. Because in hospice, you have somebody who's talking the family through the process, talking the patient through the process, kind of being the advocate and helping. So just kind of being there for support and whatever's needed.
Yeah.
Yeah, that's cool.
Yeah.
And the postpartum doula, I think that's very interesting. My neighbor is a postpartum doula, and you kind of think, oh, the baby's here, done. But not necessarily.
Yeah, well, it goes back to what we were saying about the laying in, right?
Yeah.
And so there's things that can be really challenging after the birth, right? So breastfeeding and or feeding can be a little bit challenging. Hospitals and doctors have all these benchmarks about baby weight, and it can be really stressful if your baby's not meeting that, even though, kind of from the outside, not being a medical professional, sometimes I kind of question, like, how strict they are about some of those things. Right. But ultimately, again, they're trying to make healthy mom and healthy baby come out of the process. There's also, adjustment of, your whole family has shifted.
Oh my gosh.
So your partner might be having issues. If you have other children, they might be having issues. You may not want to be cooking for yourself. If you've had a cesarean birth, you've had a very serious surgery. Right? You've been catheterized. There's all these, you have stitches, so you're kept in the hospital longer, but then you have a longer recovery, for sure. So there's all kinds of things that can be happening. Plus you're not sleeping very well, right? And you're trying to catch up on sleep. You're trying to connect with your baby and feed your baby. And you also need to feed yourself and maybe your partner and maybe your in-laws. And so a postpartum doula can do laundry. I mean, there's really like a huge amount of stuff they can do. There's, and it kind of is, you would work with your postpartum doula to figure out what that is that you need.
Sure.
Right? Some women need help with the breastfeeding. Some women need help with laundry. Some women need help with cooking. Some women just want to sleep, and the postpartum doula takes care of baby while you're sleeping. So there's kind of a wide variety of things that can be helpful.
Well, and your body's healing too, and you might have stitches in places where you're not sure how to clean it. And
so you might get a massage also from them. Yeah, it's really kind of unlimited probably what you could arrange, or, based on your needs.
Oh, sure. Yeah, well, and again, what we were talking about, how it used to be that your sister would come in, your mother-in-law would come in, your mother would come in, right? Since we don't necessarily have that these days.
Yeah.
And somebody to help.
Exactly. And when when you live far away from your family, you have to arrange, when do they come? What if the baby comes late and they've already been here for a week and a half? What if the baby comes early and they're not here yet? So there's all kinds of things that can happen to make it challenging for family to be around.
I could see that too. I mean, it's stressful to have family around sometimes anyway.
Right.
When they're from out of town and you're kind of getting on your foot, messing with your routine and everything else.
Sure. At the very least, it's like someone else who's in your house who does things a different way from you.
Right, exactly.
Whereas the postpartum doula, I think you get to kind of encourage her to do things your way. You know?
Exactly. Well, I mean, you are paying this person to do this too.
Yeah,
so,
their job is to make it easier for you, not harder.
Yes, absolutely. And sometimes then we get family drama in the mix as well.
Yeah. Yeah.
You know, and it could go back to their own birth trauma. I mean, we were talking earlier about how birth trauma results in root chakra issues for the baby specifically. Like if there's some sort of trauma where the baby needs to be taken away, or the mother just isn't available, needs some medical intervention. You know, then you don't get that bonding right away.
Sure.
You know, they don't get that touch, etc. So that huge root chakra issues, and I think that. You know, it's just kind of my world is that plays out through your entire life.
Oh, I'm sure. And I was going to add that I have a few clients who are my mom's moms. So I've got some like postmenopausal women who are my clients, and I really enjoy that population also.
Oh, interesting.
But it's so interesting to me that like they know what I specialize in, and they know what the place is kind of geared towards. And they come in, and often on my table, they'll share their own birth stories, which often they've never told anyone about. Wow. So, and it's been 60 years or 65 years, you know? And often they're traumatic because they were at a time when, again, women weren't very well supported in their process. And it's fascinating to me, right? And I love being able to provide that space for them to share those things.
I mean, I remember my grandmother, she said that she would be put to sleep and wake up and there's a baby.
Right. Yeah, it's like magic.
Right. And who would, you know, really be able to be present for that and be able to call shots? I mean, basically the doctor runs the entire show, and so the mom's taken out of the equation. So that's got to be very traumatic.
Yeah, you have to wonder how they even labored, you know? I mean,
I wonder if they did.
Well, I don't know. The babies have to come out some way,
They
right?
sure do.
Yeah.
It's a mystery.
Yeah. Maybe you'll get a caller. Maybe someone will call in with their...
Oh, that'd be nice. Yeah, if anybody has an idea of how that happened, please let me know. Put a comment in YouTube or send a message to Radiate Wellness. I would love to know how that happened, how the baby got out without a labor. I can't even imagine. But you know, we have all these stories, and sometimes the issues that we have in our life can even go way back to birth. And for babies who aren't touched and handled and held, if there's some sort of they need to be put in an incubator, they're premature, or something happened, oh man, the issues can come up so much later in life, and we don't realize. Then what you were talking about earlier with the sexual trauma playing out in the birth scenario as well, because that's all up in the second chakra. You know, carry all that stuff there. Relationship trauma.
Yeah, it's a lot. It's pretty heavy stuff. Yeah.
It really is. Isn't that amazing? And so, do you have an energy worker at the center?
I'm trying to think. Well, we have a somatic psychotherapist.
That's helpful.
Who does like touch work and movement during the therapy.
Love it.
You know, I don't think that anyone there specifically practices, say, like Reiki or any other energy.
Chakra alignment, chakra balance, and chakra clearing.
I don't think so.
That might be something good to add.
Yeah.
You know, I work with a lot of pregnant women, and oh man, we just hold so much of this trauma and this energy.
Yeah, I'll have to brush up on that. I have taken a couple classes in the chakra stuff, and I have these beautiful little colored stones, but I that's not really a normal part of my practice. I'll have to look into that.
Look into that. Yeah, maybe get some Reiki going on.
Maybe so.
Or something like that. That'd be interesting. Yeah, because we just hold especially women, we just hold on to so much stuff.
Right.
You know? Yeah. And then it shows up in the body. It shows up some place. And this stuff can show up, like I said, years later. It's amazing. So you've been doing this for quite a while, 15 years-ish years. Are there any stories that stick out for you?
Oh, my gosh.
To put you on the spot. Either good or bad.
Oh, gosh. You know, they're all fascinating, and they're all amazing. I'm trying to think. Well, I just the other day had a client who was on her 5th pregnancy.
What?
And so that was pretty entertaining. She told me about a number of her pregnancy experiences,
Sure.
Remembering back to all of her children, and so that was kind of fun to go through that with her.
Yeah.
I have had a few traumatic things come back in postpartum, but I don't really need to share those, I don't think. And I don't know. I think my favorite part of the massage and how I get to know the families and their babies is that I often do a very gentle abdominal massage. And so it's a great way for the mom to connect to the baby and, to share like what they're thinking about the names and all those things. I mean, we've had a lot of successful, wonderful births. And so it's always just good to hear the stories from that.
Oh, yeah.
Yeah. Yeah, I did have a mom the other day. It wasn't necessarily traumatic or celebratory. It was kind of a little bit of both. She was birthing her, I believe, fourth baby at home by herself, which is not something we run across very often.
Nor would I imagine recommend.
Not me personally. I would not recommend that,
Right.
no. It was actually the second time she had done it. But this time she wound up having a little bit of a complication where the placenta didn't deliver. And so she did wind up having to go to the hospital. But, I mean, what a crazy...
Was this by choice?
It was by choice.
Interesting.
Yeah. She just knew,
Wow.
felt like she knew what her body was doing and decided to do it. And luckily for her, it worked out. Again, back to
Yeah.
the whole idea of moms and babies surviving the process. That's challenging, right? To not have any kind of supervision or support around except for your husband. So, that one stands out.
Oh,
to
she
me a
did
little
have her
bit.
husband with her?
He was home.
partner?
Yeah. Mhm.
Yeah.
Yep.
Wow. I mean, it's amazing that anybody gets born and lives to tell.
It is kind of amazing. Yeah.
I mean,
Yeah.
all the things that happen in the body and that need to happen,
Mhm.
it's just kind of amazing
Yeah.
that it ever succeeds. But,
Yeah.
I mean, it does all the time, every day.
Yeah, I'm sure that some of our birth doulas that work in the office would have some great birth stories to share. And unfortunately, I'm not normally there for the birth. So, I just have the more I get to see these champions carrying these babies all throughout the
absolutely.
pregnancy. And then they come back and they have a little baby with them,
See, and that's a reward in itself.
I should show you sometime. I have a bunch of texts on my phone from my clients sending me pictures of them with their babies in the hospital,
Oh,
I have to cancel today.
They have a very good reason.
Yes, exactly.
Oh, that's awesome. I know, my with my clients, I love to see the sonograms and the babies afterward, and
Yeah, they're
it's
awfully
just
sweet.
so fun.
Yeah, and it's fun when they move around. And,
Oh, yeah.
it's great to see the mom connecting. It's interesting because we have a special pillowing system, but it's not the one where sometimes people get put on their stomachs, which I don't think anyone in
For
our
massage?
office. Yeah, there are these special pillows that you can be in, and some people find them lovely. They're a little bit one size fits all. And so we don't tend to use them in our practice, but we
Yeah.
have a way of putting the women on their sides that's
Yeah.
really comfortable and have special pillows for that. But at the end of the massage, we often have them in a semi-reclined position, so they're at kind of like a 45-degree angle. And they often just kind of, again, they sit back and we expose their belly and they just kind of, and they'll touch their belly and they'll talk to their baby, and it's really lovely.
Oh, well.
Yeah.
I had two clients at the same time who both had twins. And that was so fun because you could see both of them just kind of rolling around in there. And I don't have the facilities to do the pillowing and the 45-degree angle, but so it gets a little creative.
I'm sure. Yeah.
You do what you can to get them, and then there's a lot of changing. It's like, well, you're comfortable, and that'll last maybe 10 minutes, and then we have to move again. But,
right.
but
Just
it's
like why they're not sleeping.
Exactly.
Yeah, it's a little window into the prenatal woman's bedroom, right?
Well, and it's so funny is because many times they'll fall asleep on the table. Mm-hmm. Yeah, do you find that too?
Yes.
Oh, yeah. They get so relaxed. It's like...
Yeah. Yeah.
I'm laying down for 5 minutes. I'm asleep.
Yeah.
Yeah.
And it's good to have that time to kind of decompress and,
absolutely.
To either take a break from their family that they're raising or to take a break from their job or both possibly,
Where nobody's going to call you, nobody's going to ask for something,
right.
nobody's going to bother you.
Exactly.
But, I don't think we can overstate that enough, the role of relaxation in this and the role of just release. Every now and again we have to have that, and you provide it with massage, I provide it with Reiki, but there's so much healing in that, and resetting the body, resetting the mind, relaxing the mind. So, that's really half the battle there, and it's so healing.
It is, and often just, women come in and they're a little on edge and they've got dark circles under their eyes and they're kind of curled over from the weight of the baby and their work and everything that they're carrying with them. And then after their massage, they're like clear-eyed and a little bit more upright, and their faces are, flushed full of blood, and they're rejuvenated. And that's a really great feeling too, to be able to provide that.
Well, and in Reiki too, just the role of managing anxiety. Yeah, and especially with pregnant women, I think that I usually see them for anxiety.
I'm sure. Yeah. Well, there's regular anxiety, and then there's all the added, 21st century anxiety, right? And then there's all the additional, like, is my baby going to be okay? Am I going to be okay? What's our new family going to look like? Am I going to be a good mom? Am I, is my partner going to be a good parent also? Yeah. What about this 2-year-old I also have,
Yeah. Is everything progressing the way it's supposed to be?
Right.
Am I going to maintain this?
Right. The doctor said the baby's a little small. I don't know what that means. The doctor says the baby's a little big. I don't know what that means, So you really can't say much of anything and have it be comforting,
No, absolutely, you'd not know.
It's all kind of worry-inducing on some level. Yeah.
And then you've got people coming up, oh my God, when I had my kid,
Right.
I tell you there's
you don't really need to share that. Yeah.
No, you don't really need that. So
in fact, I was unconscious. I don't even know how it came out now.
Seriously, if you know how that happens, let us know.
Right.
Inquiring minds.
Birth by anesthetic.
Does that happen? Are they pushing it out?
I'm not sure.
Magic. Something happens. Obviously, my mom was born that way. I'm sure your mom was born that way.
I don't even know.
You don't even know.
I don't even know.
Were you born that way? Was your mom born
No, my mom was a warrior. She had 2 babies, nothing. Was like, get away from me with your needles.
Awesome.
There are many ways to birth, but that was her choice, right? To go that way. So that was good.
Yeah. No, like I said, I didn't have the pleasure. Yeah. So I don't know how I'd react.
Yeah.
You see the.
Well, and it's interesting because I think that's a place where people tend to have a lot of judgment, whether they've had babies. If they haven't had babies, I think they have a lot of opinions about how it should go. And if they haven't had if they have, what am I trying to say? If they haven't had babies, they often have opinions. If they have had babies, they have different kinds of opinions based on their own experience, right? And so that's a tough one. And I asked one of our psychotherapists what she sees. She's also a birth doula. So I said, like, what do you see? Like, how do you see people manage their pain? How do you navigate your own feelings about that? And she had a really interesting answer. She said, I have seen the same woman give birth multiple times. I mean, she has a number of clients that she's seen in this fashion, but she's like, one woman comes to mind that her first birth, she wanted to have a natural birth, and she did. She kind of walked in there and she breathed through it and she had a baby. And everything went totally smoothly. And she said her next pregnancy, she walked into the hospital and had pain that she could not manage and, took on all the interventions of, had an epidural and had all this other stuff. And she was so disappointed in herself.
Oh, wow.
Which was interesting. But, to hear my colleague Genevieve say, and I watched this woman have these 2 experiences that were so different, and yet they were the same person. So there's really no rhyme or reason, you know. You can just kind of lay the foundation for how you'd like to see it go.
Right.
And then you have to kind of hope for the best and provide some support around yourself to maybe help you get there. Right?
Wow, yeah, exactly. I mean, you have to have a vision for how you'd like to see it go, but then know what you'd be open to.
Right.
You know, there's some people like no drugs at all, and then when it gets unbearable, you know, they do say, okay, yeah, give me the epidural, and then they beat themselves up about it. But, you know, you've got to know what you'd be willing to do.
Right.
You know?
And I don't think that you should beat yourself up for having a birth go not quite the way you thought. Yeah. And
absolutely.
So again, like having some support around you to make you feel like you're buying into the solutions that are presented to you. Right?
Exactly.
If things are changing or, you know, moving in a direction that you didn't expect.
Exactly. Well, so many times that goes back to our inner dialogue anyway. You know, it goes back to our old issues that are being presented in a new way. And then if people are beating themselves up, it could be because they're thinking about their third grade spelling test or whatever, you know, and how they gave up on that. So you never know what somebody's trauma is based in.
Yeah, what they're bringing to the table.
Exactly. Yeah, you don't know.
And in my case, literally bringing to the table. You know?
Oh yeah, exactly. The massage table.
Yeah, and so I'm not there at the births with the women, but I like to be there supporting them before and after.
Well, and that they text you. And saying, well, I just had my baby, I wanted to show you. I mean, that's a testament to how much you're valued.
Yeah.
And how your work is valued.
Thanks.
You know?
Yeah.
Well, it's been a total pleasure talking to you. This is
you too.
just totally fun. Totally fun. I love to hear stories about birth and babies and all like that, and how we become families. It's always interesting. And seriously, if you know how a baby can be born without the mother being awake, please let us know. We want to know. Yeah. So, Jeanne Mitchell, thank you so much. Thanks for coming in to talk to me.
Yeah, awesome. Thank you, Christy.
This was fun.
Yep.
Radiate Wellness is a community of holistic and alternative healers and consultants based in the Kansas City area, dedicated to helping you create spiritual, energetic, and physical well-being. To learn more about our practitioners, services, classes, and events, or to schedule an appointment, visit us at radiatewellnesscommunity.com.